All right, guys, let's get going here. Thank you again for jumping on the webinar today. This one I'm actually going to tell you is probably going to be really short and sweet. I know it's a very busy time of the year. Typically, these webinars are about 30 minutes. Normally, I have a subject matter expert on to interview to go over a specific solution to bring you guys, to show you guys today. What I thought I would do is just spend some time on the top 5 health insurance trends I believe you need to leverage going into 2020 if you're not already. Now, when I say trends, what I'm saying is, call them predictions, call them what I see as coming down the pike or where I see things heading into the future of health insurance. But I also think these are very important topics you need to be aware of. And there's going to be ideas and strategies included in these 5 trends that I think you could definitely leverage next year to help your team, help your organization build a better health plan for less money. That's always the ultimate goal is what can we do to continue building better health plans while we continue to bring money back to our employees and to our bottom line. A couple housekeeping items. If you guys have any questions, I'm going to keep this very low key today. If you guys have any questions, please feel free to put them in the Q&A box or just put them in the chat box. My goal is at the end, I will go into the chat box, into the Q&A, and answer any questions you guys might have. So let's get started. I'm going to level set by giving a quick background as to maybe why I decided to put this webinar on with this specific topic. It's December 12th. And I hope for most of you, if your health insurance was renewing this time of the year, whether it's December and January, decisions have been made. For many of you, you probably have already conducted your education meetings. Things are kind of in place, winding down. For some of you, you still may be caught in the craziness of trying to get everything wrapped up for your benefits for 2020. But here's the deal, whether you've made decisions or not, or you're about to make a decision on where your health insurance plan is headed for 2020, in talking with a lot of employers today, I see a couple common themes going on with health insurance decisions right now, especially with this 2020 renewal, as most employers are renewing here on January 1st. Number one, your decision included some kind of disruption. And so, yes, decisions are made, things are in place, employees are educated, but you're not overly happy with the decision maybe because it did come with some disruption. What is disruption? Well, could be the fact that rates went up, costs went up again. You have to pass some of that cost on to your employees again. Disruption could be that, you had to change insurance companies. Sometimes that's good, but that also can be bad. Whether it's good or bad, it does come with disruption because employees are now relearning how to use a new network, work with a new insurance company. For some employers, it was a need to change insurance companies because the rate increase your current insurance company wanted was just too large. Or you stayed with the same insurance carrier, but you had to raise your deductibles, you had to raise your out-of-pocket limits, you had to completely tweak and kind of water down the benefits yet again so you could keep cost in line. That's what I'm talking about when I talk about disruption is decisions are made, but yet again, the decisions came with some disruption to you, to your organization, and to especially to your employees. The second thing I'm seeing right now is where employers are making decisions, the decisions have been made, and it's kind of like the health insurance plan has been filed away for another year. When I ask, what is your plan now that you've made the decisions? What is your plan for 2020? Many employers don't have a plan. It's kind of like, well, we hope next year's renewal isn't as bad as the one we just went through. And there's just no plan of attack. There's no proactive approach to what can be looked at, what strategies can be implemented next year to really start reining in cost and really start bringing control to that 2021 renewal. And then the third thing I'm hearing quite often right now is, okay, so if you don't have a plan in place, what is your strategy? Well, we're just going to wait until next renewal. We'll see how rates look next October. We'll determine what decisions we're going to make at that time. And I'm here to tell you that that's a strategy set up for failure because it's no strategy whatsoever. It's kind of like deciding what you're going to do with the house, calling the fire department, and now the house is already on fire, the house is burned down, and now you call the fire department in to take care of it. That's the same way when it comes to dealing with your health insurance renewals. If you wait until the rates come out to decide what your strategy is going to be, it's too late. Now you're in defensive mode, you're in reactive mode, and you're just trying to figure out what you can do to take care of the large increase you're dealing with versus already going into the renewal with a strategy, with a plan of attack, regardless of the kind of renewal you are about to see. So knowing that this could very well be you on this webinar right now, your renewal could have had disruption, you might not have a plan for 2020, or you're just going to kind of wait and see and cross your fingers to hope next year's renewal isn't as bad as this year's is or was. This is what this webinar is for. I want to kind of dive in or take a peek into 2020 and go over 5 trends I'm seeing right now, 5 predictions I have about how employers, how you can really leverage some of the things that are out there today to take control of next year's renewal, start bringing back quality benefits to your health plan, and most importantly, help your employees get really high quality access to the healthcare system. Because if you've been on my previous webinars, you've heard me say this multiple times. At the end of the day, whether you fully insure your plan, you self-fund it, whatever you do, the decisions your employees make inside the healthcare system ultimately drive the insurance costs you are dealing with. And my ultimate goal with every webinar, my ultimate goal with my clients that I work with is to help them realize that it's not about buying insurance. You don't have an insurance problem. What you have is a risk management problem. And when you start focusing on your claims, medical and pharmacy claims inside your health insurance plan, and you help your employees navigate the healthcare system effectively, that is really how you can start increasing or bringing back the benefits you used to have years ago for less money than you are paying today. So with that being said, why don't we just get right to it and start diving into these 5 trends that I expect our industry to see next year. Number 1, HSAs are losing popularity. Now, what in the heck do I mean when I say that? Let's go back 15 plus years when HSA health savings accounts were introduced to us. The whole purpose of bringing the HSA component into the marketplace for employers, for individuals, was predicated on the theory that if we raise deductibles, if we give employees the opportunity to set aside money ahead of time to pay for future medical expenses, consumers, employees, individuals alike are going to become better healthcare purchasers. They're going to become better consumers. 15 years later, I am here to say that has not happened yet. And the challenge that I see a lot of employers facing today with HSA plans is that most employers have made the decision to go to an HSA plan simply because it's a cost containment measure. By increasing that deductible, by doing away with the copays on office visits, specialist visits, urgent care, medications, you ultimately do impact your premiums, right? You lower your premiums by increasing the deductible and getting rid of the copays. And if you guys can remember, if you on this webinar are on an HSA or you remember moving to an HSA many, many years ago, the premium differential between the traditional PPO plan and an HSA was huge. I remember days of bringing and showing HSA plans to my clients 10 years ago, and the premium differential in some cases was 25, 30, 35% of what they were paying in a PPO plan, talking about 30, 35% less. Today, that gap is much, much smaller. Here's why. As employers have navigated or migrated to the HSA plans, a couple things have kind of gone wrong with the strategy. Number 1, far too many employers have moved to an HSA or a high deductible health plan, but are not funding the health savings account itself. And they're relying on the employees to fund that account by themselves. And the challenge with that is today, when 70, 80+% of the working Americans out there are living paycheck to paycheck, it is very hard for employees to be able to set aside money to put into the HSA accounts. And the consequence of all that is here now we have high deductible health plans that have $2,500, $3,500, $5,000 deductibles without any money being put into a health savings account. So it's really nothing more than a $4,000 or $5,000 plan where the employee has to pay the entire $4,000 to $5,000 up front before there's any coverage. As a result, consumers are avoiding care. Employees can't cut a check for $4,000, $5,000 if they have to use the healthcare system, if they were hospitalized. Heck, most Americans today can't cut a check for $1,000. And so as these HSA deductibles, these high deductible health plans, the deductibles have continued to increase, employees are not becoming smarter healthcare consumers. They're actually just avoiding care altogether. And I think it's very easy to understand what happens when you avoid care. All of a sudden, it becomes too late. You wait to take care of a healthcare issue that you should be addressing today, and you're not because of the cost. And you wait until much, much later when that healthcare issue is much worse, resulting in even higher cost. So in the end, summarizing bullet point number one, HSAs are definitely losing popularity. You're seeing more and more employers go back to the PPO structure. You're seeing more and more employers bringing back copays, and you're seeing more and more employers start to look for ways to help their employees access high quality, low cost care and rewarding their employees for those decisions by actually making that access free to the employee. And again, if you've been on my previous webinars, you've heard me talk about that, and we're going to talk about that here in a little bit. So trend number one, HSAs are losing steam. The PPO plan is starting to make a rise again. Trend number two, smartphone solutions are a must. If you are not using a smartphone solution tied to your benefits today, you need to start getting on this right away. Now, what do I mean by smartphone solutions? Obviously, we're talking about apps that go on the smartphones of your employees. Now, I'm a big believer that the apps that a specific carrier, a medical carrier, provides directly from their plans isn't enough. An app provided by, say, a Blue Cross Blue Shield, a Cigna, a United Healthcare, they're good apps, but they're really directed to help people just use what's available through United Healthcare or whoever that specific carrier is. You really need to start looking at third-party smartphone solutions. Now, here's why. If you're on this webinar right now, I'm confident in saying that you have at least three, if not four generations in the workplace, right? We've got baby boomers, we've got Gen X, we've got millennials, which is Gen Y, and then we got the new generation coming out of college, the Gen Z. The one thing that connects all four of those generations is the smartphone today. Everybody is using them. Now, I often am told by employers saying, not all my employees have access to smartphones. And that is true. I understand that and I empathize with that. But I think when you think about designing your benefits and designing your health plan, you have to understand when you say that, what you're really talking about is probably less than 5% of your population does not have access to a smartphone. So when you're putting strategies into your health plan and you're going to incorporate smartphone solutions, you have to realize at the end of the day, it is going to impact and help the 90, 95+% of your workforce. Now, what are some of the smartphone solutions that are out there today that I like, that I think are doing a great job? Number one, Benezon. B is for a quick spelling of Benezon. It's B as in boy, E, N as in Nancy, E, Z as in zebra, O, N as in Nancy. We provide the Benezon app as part of our solutions to our clients. Here's what the Benezon app allows you to do. Number one, all of your employees can access all of their benefits, whether it's medical, dental, vision, life, long-term disability, from the app, from the phone. It gives them the opportunity to take photographs of their ID cards, so they never really have to carry their ID cards with them anywhere. Number three, it gives them access to simple solutions like GoodRx, which is a prescription drug solution, which allows them to get discounts on their medications at specific pharmacies in their geographic area. And it also gives them access to concierge services, which I think is the biggest component, which is when your employees need help understanding their benefits, especially their health plan, often they end up in your office asking you a bunch of questions and needing immediate help. What the concierge piece allows or provides on the app, especially on the Benezon app, is it gives them that 24/7 access to help understanding their benefits, whether it's a question on what is their deductible, whether it's helping them find a doctor, or you have an employee that has a medical bill and they're freaking out because they don't understand what they owe or what the medical bill is saying. That concierge component helps answer all of those questions for your employees. And more importantly, what I love about the Benezon app is their team, their concierge team, speaks over 100 different languages and dialects. So if you have a bilingual or a bilingual workforce, it's a very, very advantageous solution to have because it can help all employees no matter what language they're speaking. So again, Benezon is a great app. Another great smartphone solution out there today is HealthJoy, which also provides the same concierge, same benefit structure as Benezon does. Strive, S as in Sam, T as in Tom, RIVE is another great one. But point here, guys, is heading into 2020, I highly, highly urge you to start pursuing smartphone solutions if you're not, because it's going to lead into another trend that you're about to see. And here's the one last very cool thing about smartphone solutions. You can implement them at any time throughout the year. This isn't something you have to wait until next renewal to implement. You can get on looking at smartphone solutions right away in 2020. If you don't know where to start, guys, you have any questions, just shoot me a message. I'm more than happy to connect you with Benezon or HealthJoy or any of the other solutions out there. So trend number one, HSAs are slowly on their way out. PPOs are coming back. Trend number two, it's time to start using the smartphone solutions if you're not already. Trend number three, and this is a dovetail right into the previous trend you saw. Start leveraging video-based education. I'm going to go back to what I said just previously about the smartphone. Everybody is using them now. And when you can give your employees the ability to watch the education whenever and wherever they want, that is only going to take your benefit education to the next level. Let me give you a couple of examples. When I do education meetings for my clients, more often than not, especially if I'm doing one big education meeting, we will often record those. And if our specific client has access to the Benezon app and is using the Benezon app, we have the ability to take that entire recording and plop it right into the Benezon app. So now, throughout the year, employees can watch that education meeting whenever and wherever they want. And here's why that's advantageous, and here's why you need to be leveraging that. For most employers, they educate their employees once a year. So if it's a January renewal, they typically educate them sometime in November or December, and that's it. And all of a sudden, 7 to 8 months later, healthcare happens to one of your employees. They have to use the healthcare system. And they have completely forgotten what they have. They have completely forgotten about the solutions you've given them. By using video-based education and giving them easy access to it, they now can go back and quickly watch whatever education you provided, which is going to help them bring themselves up to speed on exactly what they have. On top of it, if you guys are leveraging any of the strategies and the solutions I have talked about in previous webinars, whether it's a prescription saving solutions like script sourcing, the webinar we did 2 months ago, whether it's the healthcare navigation solutions like AIM, which we had on last month, you now can actually do videos. We do videos for our clients, 90-second education videos on each solution. I call it the what, the how, and the why videos that you can also plop into these smartphone apps. So now again, your employees can watch these videos whenever and wherever they want. Guys, it's a huge game changer for your benefit education. The company newsletters, the simple email blast aren't working as effectively as they used to. Video is where it's at right now. So if you're not using video-based education right now, I highly urge you to do it. And I promise you, you are going to see an uptick on how your employees are utilizing your healthcare and your benefits that you provide. All right, trend number 4. Self-funding is on the rise. Again, I've talked about this in previous webinars. I talked about it. I did a webinar a few months ago walking you guys through the 5 steps of building the perfect health plan. And step number 2 was financing the health plan. What you're seeing a rise in today is the number of employers and the size at which employers are looking at self-funding. It used to be employers waited until they had 100, 250, sometimes 500 employees before they even considered self-funding. Nowadays, you're seeing employers all the way down to 30 and 40 employees look at self-funding opportunities. Here's why. It means control. Employers are starting to understand that if you truly want to control your health insurance costs, you have to put yourself in a better financing arrangement. And self-funding gives you the ability to do that effectively. And quite frankly, with the solutions and the way things have changed in recent years, self-funding is not as scary as it used to be. And a couple things have come about that have given the employees the ability to self-fund with more confidence. Number 1, you're seeing level funded plans out there today. Although I don't believe it's true self-funding, it is built on a self-funded chassis, but it gives you the cost cash flow confidence that you are going to pay a consistent cost every year. But because level funding is a self-funded plan by definition, you have the ability to get money back at the end of the year. And there's also true self-funding, right? The big difference for true self-funding is that with claims, your medical and pharmacy claims, you are only paying those claims as you go month by month, and the claims you don't have are the claims and the money you keep. But the game changer right now in self-funding for smaller employers, call it those employers between 30 and 100 employees, which probably describes many of you on this webinar, is the rise of what we call captive health insurance, where you as an employer can now join a bunch of other employers your size to form a much bigger group. So now that gives you the ability to self-fund more cost effectively, more confidently with less risk. And the beautiful thing about captive health insurance arrangements, gang, is that they've already been built. You as an organization don't have to go build one yourself. They exist out there. There's dozens. You just need to find the right one. And here's what I'm going to tell you right now. And I know some of you on the webinar may not want to hear this, but I'm going to say it. If you're working with an advisor right now who's advising you away from self-funding, you need to start challenging that. This is truly the only way, guys, you are going to control your health insurance cost. So if you're working with an advisor who's recommending you stay fully insured, who's trying to get you to shy away from looking at this, you either need to challenge that or you need to be talking to other advisors, because it's a very cost-effective way to manage and finance your health insurance plan. All right, trend number 5. Start utilizing and strategizing your worksite benefits more effectively. You're going to see a much larger increase in the way employers use worksite benefits. Now, I wanted to put a little humor into this webinar. So you're seeing an image of a duck with some other ducks going, Andy, what is this image all about? Well, I couldn't just go steal an Aflac logo. So I put an image of a duck on there because everybody knows Aflac and everybody knows the duck. So what am I talking about worksite benefits and how to strategically utilize them? What you're seeing right now today is a rise in the use of benefits like hospital indemnity, which pays your employees a check, cuts your employees a check if they are hospitalized. You're seeing a rise in accident plans. If one of your employees has an accident, based on the type of accident and the type of bodily injury, worksite benefits will cut a check to your employees. Now, here's how employers are starting to use this strategically. It used to be you just offer worksite benefits. You really didn't care about the level of the benefit. They're voluntary. Employees can sign up for them if they want. We don't care. We don't really care about the cost because the employee's paying it. Now you're starting to see a change. You're starting to see employers really utilize worksite by looking at what their medical deductible is and starting to pair the hospital indemnity plan, the accident plans as a backfill to that deductible. So if you as an organization have a $3,000 deductible, medical deductible, and one of your employees is hospitalized, which is going to have him or her hitting that $3,000 deductible, you now may have an accident or a hospital indemnity plan that's going to cut a check for back to your employee that will literally cover most, if not all, of that medical deductible. So the message here is worksite benefits are good, they're effective, but really start thinking about them strategically and how you can start designing the worksite benefits to match the medical plan you offer. Now, I told you that I had 5 trends today. I do want to give you guys a bonus. It's an outside the box bonus, but something I do want to talk about because you're seeing a rise in this type of medical, or I should say health plan that employers are starting to offer today, and that's this: cost sharing plans. If you haven't heard of cost sharing plans, here is what I am talking about. You are starting to see employers offer a plan that sits as a side-by-side with your current medical plan that offers some preventative care coverage. Think of it as a minimum essential coverage plan, what you might know as a MEC plan. It provides some preventive care coverage. It provides your employees access to some generic medications at no cost. And it gives your employees access to things like chiropractic, primary care, day-to-day coverage at a minimal cost. It's not true insurance, but it provides your employees with access to the everyday, day-to-day preventative care coverage at a very, very affordable price. But on top of it, employers are now starting to offer cost sharing plans. What a cost sharing plan is, all plans like this they all started as what was known as ministry sharing plans. So you had to be affiliated with a certain ministry, certain religion. That's no longer the case. But what these cost sharing plans involve is it's an umbrella that sits over this minimum essential coverage, this preventative care coverage, that ensures that should one of your employees have a big claim, a large claim, all the members, all the employees outside of your organization and inside your organization that are participating in this cost sharing plan, all those premiums they're paying contribute to help your employee to pay for that high claim, that high cost claim. So how it works is you've got the day-to-day coverage underneath, the MEC plan, and then you've got the cost sharing, call it umbrella, sitting over it to ensure your members have access to coverage should a high cost claim be incurred. Now, I want to reiterate, this is not true insurance, but it's another option you can add to your portfolio if you want to give a certain type of workforce access to affordable coverage. Here's a classic example. If you're a blue collar employer and maybe you have a very low paid workforce where you have low enrollment in your medical plan because for many employees, they simply cannot afford that plan, so they don't sign up for it. Some of them will be eligible for Medicare. Their children will be eligible for Medicaid, but often those employees are going without any coverage whatsoever. Offering a minimal essential coverage plan with a cost sharing plan umbrella on top of it would give those employees access to some kind of coverage should they have to use the healthcare system. And on certain plans that I work with, that our agency works with, some of those plans can come with single premiums, single monthly premiums as low as $225 a month, which is much lower than the single premiums we're seeing in a lot of commercial medical plans today, where that single rate can be $400, $500, $600 a month. So if you're out there listening in on this webinar, you do have a low paid workforce, you're seeing a good chunk of that workforce maybe forego signing up for the benefits because of the cost. Think about these minimum essential coverage plans and pairing it with a cost sharing option. It can be a great way to give your employees a second option for some kind of affordable coverage. Now, people ask, Andy, what are some options out there of these minimum essential coverage plans and cost sharing plans? Two that I pair very well together, and I see a lot of employers pair together, are a program called Redirect Health. They have a program called Everyday Care. And then the cost sharing plan, the umbrella on top, is a program called Sedera Health. And that's S as in Sam, E, D as in David, ERA, Sedera Health. So pairing Redirect Health's minimum essential coverage everyday care with Sedera's health cost sharing plan can be a great way to offer that low paid workforce who's not signing up for benefits an opportunity to get some form of coverage that they just do not have today. All right, we're butting up against a half hour, so I want to quickly rehash the 6 trends, and then I'm happy to answer any questions that might be coming up. Number 1, guys, trend number 1, HSAs are definitely slowly on their way out. They're never going to be fully out, but they are on their way out. More and more employers are looking for ways to bring the PPO back. They're looking for ways to give their employees access to high quality health insurance at a very affordable prices. They're looking for ways to help their employees get access to the healthcare system at high quality, low cost. Start focusing on that, and I promise you, you'll bring more control to your health insurance plan. Number 2, start utilizing smartphone solutions. Whether it's Benezon, whether it's HealthJoy, Strive, or anything else out there, start integrating those smartphone solutions to help your employees access their benefits package much more effectively, much more quickly, whenever, wherever they want. Number 3, start leveraging video-based education. We as an agency decided to get into video-based education because we know it works. So as advisors, our clients are starting to receive that video-based education. I see some of my clients on this webinar. I know they're getting those. Trend number 4, self-funding is on the rise. If you're an organization, you're sitting on this webinar, you have 30, 40, 50 plus employees on your plan, start looking at that as an option, guys. It's definitely an option. And again, if your advisor today is simply not bringing it to you, you need to find a way. You need to challenge him or her, or talk to an advisor who is bringing those self-funded solutions. Trend number 5, definitely utilize Worksite. Strategically, start pairing your Worksite benefits, the coverage, with the medical plan. Make it more effective. You'll get better utilization. You'll get better enrollment from your employees. And then bonus number 6, start thinking and looking at these cost sharing plans. Again, if you're a blue collar workforce, you have low wage employees who are not signing up for the benefits, this can be a great option to give them some form of affordable coverage, some form of affordable access to coverage should they have to use the healthcare system. All right. I'm going to dive in. I'm going to look at Q&A. I'm going to see if there's any questions here. All right. One question came in, and that's this. Andy, you talked about all of the trends. How many of these can be implemented off renewal, and how many would we have to probably wait until next renewal to implement? Great question. Simply put, if I go through the 6 trends again, number 1, the number 1 trend, which is the HSA, is obviously a change in a plan design. You're probably going to have to wait until the 2021 renewal, or if your renewal is coming up here mid-year, you can make the change at that time. Number 2, as I said earlier, smartphone solutions, those can be integrated, implemented at any time. Doesn't have to be done at renewal time, but make sure you do spend the time educating your employees on how to use them. Trend number 3, which is the video-based education, you can absolutely integrate that at any point. I would tell you, you can integrate that as quickly as tomorrow. So please start integrating video-based education. I promise you'll be happy with the results. Trend number 4, self-funding. Again, that's financing the medical plan. You're probably going to have to wait until your next renewal to take a look at it. And I will tell you, if you are fully insured today and you're looking at self-funding at your next renewal, I highly, highly urge you to start that process a good 4 to 5 months before your renewal. Trend number 5, worksite benefits. Really, often people pair that with the renewal, but I would tell you, you can add those at any point throughout the year. And then trend number 6, those adding the minimum essential coverage plan with a cost sharing program like Sedera Health. If you're just going to pair it with the existing medical plan, so they sit side by side, you can add that plan or that option at any point throughout the year. It does not have to be the renewal. One more question came through. On average, how much does something like Benezon cost? Is it by employee count or overall usage? Great question. Benezon is a per employee per month cost. So if you have 75 employees enrolled on the health plan, you would be billed for 75 employees per month for the cost. The good news is the cost of a Benazon app is very minimal. Leveraging it without telemedicine, it can be anywhere between $3 to $4 per employee per month. If you want to add the telemedicine component to it, so giving your employees the access to call a doctor over the phone through the app, now you're probably talking $8 to $9 per employee per month. Good question, yes. So without telemedicine, it's a very inexpensive thing you can implement at any point throughout the year. All right. No other questions are flowing in. I appreciate you guys being here. I know it's a very busy time of the year, so thank you for your time. I wish you guys the happiest of holidays. So, oops, hold on. Looks like we got one more coming through. One more question came through. Does any broker have information to give regarding shared plans? Great question. I am going to give you a very direct and open answer. Yes, they do. However, the question I ask is, are all brokers looking at solutions like this right now? No, they're not. So to answer that question, does the broker have access to a shared plan, a cost sharing plan? They should be looking for them. Doesn't mean they actually are. So if the one you're working with today doesn't, challenge, but also if they're not, find one who is looking at those types of programs. Great question. So with that being said, guys, I'm going to let you guys get back to your day. Have a happiest of holidays. Thank you again for your time, and we'll see you back in January for our next webinar.